Hello all, this is Dr. Alsop, and in this video we will be discussing the ins and outs of grading and assessment for DENT 545 and how you're going to get all those points that you want to earn to get the grade you deserve. There will be two blocks of assessment. There will be midterms in July and there will be finals in mid-August. For both blocks of assessment, there will be a written and a practical exam taken on different days. So let's talk some details regarding the different types of exams, starting with the written exams. These will consist of 40 questions worth 40 points in all and will be multiple choice and, important to note, not image-based. That's one of our number one questions regarding the written exams. These do not have any images on it. These will be facilitated on Canvas, and you will have 80 minutes to take the exam, which averages to 2 minutes per question. The written exam will assess concepts in the written learning objectives. So that is key here. So both the written learning objectives as well as the learning objective videos, which will cover the same content, just presented in different ways. So written exams think about the learning objectives. The practicals will be 30 questions that are going to be worth 30 points in all. And these will also be multiple choice, but these will be image-based. These images will be similar to the cadaveric images that you will see throughout the course and will be exemplar images that show the pertinent anatomical relationships that we are testing on. Our goal is never to trick, but to test your understanding of anatomical relationships and structure. So we strive to pick the very best images and the easiest to see images. You will have 30 minutes to complete the practical exams, which averages to 1 minute per question. The structures you will be asked to identify will be from the list of structures. So that's why we have that in bold here. It's kind of your contract as to what we can ask and what we cannot. If it's not on the list of structures, we're not going to ask you to identify it. And so take note that in some of the supplementary dissection videos, we may discuss structures not on the list of structures. They would not be on the practical. It's there more kind of for context. And you'll really be able to understand where these structures are within your dissection or lab or through these supplementary dissection videos. But really it's this list of structures that tells you what can or cannot be on a practical. So here is an example of the type of question we might ask on a written exam. Questions you see in the practice questions that you have through the BlueLink resources, as well as at the end of our learning objective videos, will really help give you some idea of the types of questions you might see. You may see a short clinical vignette like the one you see here. Typically, there will be 5 answer choices in alphabetical order. Again, these concepts assessed will be from the learning objectives and learning objective videos. So this gives you a nice kind of sneak peek at the type of questions you may see. Let's spend a bit more time, though, on the practical, because that is typically the exam that students are a bit more unsure of, an assessment modality that you may not have had any experience with in the past. These practical exams are mostly straight identification, as in we will literally ask you to identify the structure indicated by an arrow. However, about 25% of the questions will be second-order questions, where you need to take your identification knowledge, so you'll be asked to identify something, but then you're going to apply an anatomical concept knowledge and combine the two. So examples of this are kind of seen here. These are examples of second-order questions. So which nerve is going to traverse the foramen indicated by the arrow? So you'd need to identify the foramen first and know what goes through that hole and say the skull, as in which nerve. The questions you see in the practicals, as well as questions from the synchronous learning sessions, will be similar to what you will see on the practicals. A few things that we do not ask on practicals. The first is we almost never ask you to provide the side of the structure. Right C, left C's are not our favorite either, so telling between the right side and the left side. And usually it doesn't help in assessing your knowledge of an area. There are a few exceptions when asymmetry is pertinent. So the common carotid arteries are a good example in that the right and the left common carotid arteries branch from different points. So we may ask you to be able to identify the right common carotid from the left common carotid. And if that's going to be the case, we will point those out. We also will not ask you to differentiate between neurovasculature and a bundle. So typically nerves, arteries, and veins travel together. And it's difficult to tell which one is which when you're just looking at an image, and sometimes it's difficult to tell when you're looking in a dissection. So we would ask you to specifically identify, the question would say, identify the nerve or identify the artery, not something generic like identify the structure. A possible exception would be when the neurovasculature is very, very large, like say within the carotid sheath. So there are a few exceptions to the rules, but for the most part, that will save a bit of the headache regarding trying to memorize those things. So here's an example of a practical question. There is a red arrow. I'm going to draw a red arrow to the red arrow, pointing to a structure. In this case, it's pointing to a nerve. And we are asking you to identify that nerve. Literally, it says it right here, identify the nerve, indicated by this red arrow is this one traveling right here, which is the chorda tympani. Just for your knowledge, that's something you will know at some point within the course. So you get yourself prepped for what the exam format will be like. All right. Now, I want you to understand that we have provided you with integrated questions throughout our resources. So you should have ample opportunities to test yourself and assess your knowledge. We love practice questions when we were students, so we like to provide them as well. So you will see them at the end of the learning objective videos. This will be the main format of your synchronous learning sessions for those who are not dissecting. Also within your supplementary resources, so these resources are not required, but I think many students find them valuable. We have practice questions, we have practice practicals, as well as quiz links, which are basically a quiz version of the cadaveric atlas images. Here is the grading scale, and you can add up the points you get on the midterm to get an idea of how many points you need or how many you need to get the desired grade. You can see we do have pluses and minuses based on feedback from your colleagues that have taken this course in the past. So we're very straightforward regarding our grading scale. There are no bonus points. So get an idea of where you're at with the midterm, and you'll know how many you need to earn on the final in order to get the grade you want. Now I want to finish this video with a few important professional expectations with assessments. All assessments in DENT545 are closed. Oops, I'm so excited to underline this. These are going to be closed book, closed notes, closed resources, and closed browsers. Before you start your assessment, please put all these away from you, close out all other internet browsers, and focus on the task at hand. Additionally, during this time that the exam is open to students, this is not a time for communication with your colleagues. So don't send out an email after you finish to your colleagues like, what did you get on number 3? As they may not have taken the exam yet. So please, no communication with your colleagues during the exam block. No screenshots of the exam. You will definitely have time to review your exam and the questions at a set time with ESS. So even if you have a question about the question and you think taking a screenshot will help jog your memory to be able to ask it, this is not allowable. You can have a different time to review the exam that we'll have available to you. So just rest assured you will have that opportunity. And lastly, if any issues arise while you are taking the exam or before, please reach out to myself and Dr. Fox before or during the exam time frame, and we can troubleshoot and get you moving in the right direction. Please do not contact us the next day saying you couldn't get the exam to work. It must be during the exam time frame in order for us to successfully troubleshoot. So this is another very, very important key in terms of communication. All right, excellent. Thank you for your time here. And as with all things, please reach out to me or any of my anatomy faculty colleagues with any questions you may have.